So, good morning, everyone. Today, I don't think we have much time, but we will try our best to do whatever we can with our case presentation. We will start with this very interesting case of 38-year-old female patient with strong family history of breast cancer and abnormal ultrasound findings referred for breast MRI to exclude possible carcinoma. She has no previous history of any intervention in the breast, no like implants or whatever things, and she's healthy, just for to exclude underlying breast carcinoma. So this was her MRI and
of the breast axial section, T2.
good T2 fat saturated.
Bilateral hypodense
Hypointense.
intense area with hyperintense
Hypo ولا hyper نفتح هنا.
hypo
Make up your mind.
central
Tell me.
isointense and hyperintense.
What? What's the hypo and hyperintense?
The hyperintense is a fluid.
Is it like a lesion, a tumor, a mass? Mass. Which one? Which one are? What's on?
We just got T1 now.
Wait. Let her take her
In left breast,
left breast.
also in the right.
Also on the right. So it's bilateral?
Bilateral.
Bilateral. Single or multiple?
Multiple.
Well-defined, ill-defined?
Well-defined, rounded.
Okay. So what do you think?
With the single lesion, hyperintense in the right breast, most probably cystic.
No, most probably. It is
cystic. Yeah.
It's not most probably. So it's a breast, it's simple breast. Okay. This is on T2, fat saturated. Now, what's this sequence?
T1.
T1. Fat saturated, low non-fat saturated. With contrast or without contrast?
With contrast.
No,
without contrast. Sorry.
Do we give contrast on non-fat saturated images?
No.
Showing what?
Multiple well-defined bilateral lesion, iso-intense.
Iso to what? Iso to muscle, iso to bone?
The breast tissue.
Okay.
The fat not suppressed.
Which fat? Which fat not suppressed?
Inside the lesion.
And so the lesion has fat in it? And why would it be suppressed? And why would you expect the fat to be suppressed? It's a non-fat saturated image. So the fat should not suppress it because it's not fat saturated. You say fat suppressed or not suppressed on fat saturated image.
Yes.
So from the beginning, we have bilateral multiple breast lesions that appear well-defined, that appear.
For me, iso with
Iso to what?
To the breast tissue.
What do you mean? Glandular tissue of the breast?
Fat.
Guys, keep quiet, please. To the breast
tissue.
Breast fat.
Fat breast tissue.
Okay, because there is glandular tissue, there is fatty tissue. So it's iso to the fat.
Yes.
On
T1.
And what about T2?
Hypo.
Is it hypo intense to the fatty tissue?
Fat suppressed in T2.
So you have like 200 sequences here. You're seeing only two. Why not see the rest of it and make a better idea? What's this sequence? This is T1, fat saturated, axial. The first sequence of dynamic post-contrast images. When we do dynamic post-contrast images, we give contrast. First, we take sequence without contrast, then we give contrast, and we do other sequence and other sequence and other sequence, other sequence, just all of them with contrast to see the enhancement, so we can see the curve of the post-contrast enhancement. There is a malignant pattern, and there is a benign pattern, and there is intermediate pattern. صح? So this is the first sequence. You can see it's written T1 dynamic, 1 plus 6, 1 without and 6 with. 6 times we repeated the post. So this is without contrast. So on T1 with fat saturated without contrast, what do you see?
Hypo intense.
Okay. So the lesion is.
For me, I'm not sure, but it's iso intense. On the left side, hypo intense.
Okay. So what do you think the nature of these lesions? What are they? What's the content?
Fatty content.
Nice. Fatty content. Now, let's see the rest of the images after post-contrast, after we inject contrast. Of the diamond, take this, the SU, the subtracted. You see, this is subtracted image. We subtracted the post from the pre-contrast. When you subtract post from pre-contrast, what remains? Only the contrast. Okay? Yani, if now, let's say I am with a watch and take a picture, and then I remove the watch and take a picture, subtract the two, what you will have? The watch. صح? So we do the subtraction to see just where is the enhancement. So what do you see here? This is the first sequence after the contrast.
Enhancement, I'm not sure.
It looks like patchy,
Yes.
non-mass like. صح?
Yes.
زين. Let's see another sequence. No, this is not subtracted. دائما اختاري الاسيو. هذا الاسيو. Yeah, this is the second post-contrast sequence. When you do the enhancement curve, you'll see the timing for each one. But here they are arranged بالتسلسل يعني by order. And first, second, third, fourth, you know? A few seconds, not much. Yeah.
Bilaterally enhanced.
This pattern, it's patchy. It's scattered. When we started, I told you this is a 38-year-old patient. So she has a hormonally active, let's say, and you have the menstrual period and the pregnancy and delivery and I don't know what. So she's not menopausal, I mean. So this pattern of post-contrast enhancement is normal or abnormal? It's a normal pattern of post-contrast enhancement. It's patchy parenchymal glandular enhancement. The glands of the breasts, they show this patchy pattern, non-mass-like. However, the masses that we saw, the cysts, they show absolutely no post-contrast enhancement. Now, let's see another one. Go down, yeah, up, yeah.
Non-enhanced.
Just the patchy parenchymal enhancement here and there. Maybe this one is, see this one, wait, this here part it's related to this cyst. You see, it's like that, and it's causing some inflammatory or I don't know, irritation in the adjacent breast tissue,
Compression. Let's see.
possibly compression. I don't know. So now we have, حتى in order to not waste time, let me show you something. At the end here, we do something like compound view. The all the post contrast images compound into one image. Okay, you see just diffuse parenchymal enhancement. It's nothing specific, let's say. Okay, what else? This is T1 post contrast, normal, not dynamic image. Normal T1 post contrast, fat saturated, of course. So what do we see here?
Multiple, rounded, well-defined,
Mhm,
hypo-intense,
mhm.
lesion or mass in the bilaterally in the breast.
Nice. Do they show significant post contrast enhancement?
No.
Good. So, let us arrange the whole thing into few images. So first of all, حتى to make a good, this is T1. Just a second. This is T1 and non-fat saturated, and this is T2 fat saturated. Okay, just a second. Let's okay, and this is T1 post contrast. Where is it? Where is it? Where is it? The T1. Ah, and this is the T1 post contrast. Okay, do we have? Did we do a T2 or not? No. Okay. So now we have this lesion. Let's take one of them. We have multiple lesions, but let's take one of them, the big one, this one. Okay, which is, where is it here? This one. Now we have this one and this one. They are hyper intense.
T1.
What? What do you see here? This is, what's this? Which is, let's magnify one of them. What's this?
It's fluid.
It's a fluid level or fat fluid level. So this one is hyper intense on T1 and it got suppressed on fat saturated images, confirming it is fat.
Yeah.
And
Not
the same on post contrast, it's T1, so it's suppressed. So it's suppressed on T1 fat saturated and T2 fat saturated image with a fat fluid level. And there are multiple of them in both breasts. صح? So, what's your conclusion?
fibroadenoma.
Fibroadenoma show fat? Signal intensity? Fibroadenoma, does it have fat?
No.
It has what? It's an adenoma. It's a cell, not fat. I mean, soft tissue. First. What else? If you focus carefully, you see it looks like what in the pelvis?
Dermal.
It looks like a dermoid, right? In the pelvis. Do we have a dermoid in the breast?
No.
I looked it up. I didn't see it.
No.
Yeah, it's just so reported.
Simple as.
But it looks like a dermoid. It really looks like. Yeah,
Like dermoid.
it looks like a dermoid, but there's no dermoid. I don't.
Pokemon.
I've never heard of a dermoid in the breast, and I looked on the online of any reported cases. I didn't find any. So,
Dermal midline, Dr. Midline. Dermal mostly midline.
okay. What else?
ما يصير oil cyst.
What other oils?
Galactose.
Galactose. Possible. She has no history of breastfeeding, by the way. So, this is unlikely. Lipoma, some with infection. If it's infected, it will show post-contrast enhancement, right? Which we agree there is no significant post-contrast. So, what about oil cysts?
Yes.
Is it possible?
Yes.
Bilateral, like that,
bilateral fat fluid level.
fat fluid level. It's very high possibility of
Oily.
oil cysts, and it was bilateral large oil cysts. The question here, which was, in my opinion, the main point for this case. Oil cysts are usually small. These are big oil cysts, and that's what makes them worthy of presenting the case. However, the question is the following: which one is less dense, fat or fluid? So which one is less dense?
Fat.
Fat. So fat floats. Okay? The fat will always float. Hello? Hello. Now, let's look here. Please keep quiet. Let us think. This is the fat because it's suppressed.
Yes.
And this is the fluid. صح? Which one is floating?
Fluid.
So we said the fat should float. By show of hands, anybody has any idea? احنا fat fluid level. When we put fat on water, which one float?
Fat.
Fat. Now, which one is floating?
Fluid.
Fluid. This is against physics. Exactly. The patient is prone. The patient on the MRI, breast MRI, it's prone. So this is up. This is up. And this is down. To be more precise, the patient is like that. The fat is floating on surface of fluid. But you see the images flat. Which one? It's an oil cyst containing fat and fluid and other contents. So it looks like a dermoid, but it's just. And the funny thing, imagine the doctor is a very, very good ultrasonographer, one of my friends, my favorite friends. Anyway, she referred it to me. I've seen something on the breast ultrasound that I've never seen before. I don't know what it is. Please check it out. So imagine this oil cyst on an ultrasound with fat, fluid, and something inside, and multiple and bilateral. She never, I don't know what is this, and they are bilateral and they are big, and she has a family history of breast cancer, and she's young, and it was just multiple oil cysts, nothing else. She's young, so we didn't prefer to do mammogram because first of the young age, second probably will have very dense breast and will show nothing significant. Cystic with fat fluid level, exactly. Okay, and I did an ultrasound for her, and surprisingly, bill ultrasound, you see exactly the opposite. The fat is up and the fluid is down. I couldn't see by ultrasound, but we didn't do a mammogram. What do we have here? This is a 60-year-old female patient presented with bilateral pelvic masses on an ultrasound. Adnexia mass, exactly. So MRI was ordered for her to for further evaluation. So first was the sequence. هذا شنو السيكونس؟
هذا اللوكلايزر.
What's this? Sequence.
وأنا اللوكلايزر طبيعي.
A Turkey localizer. What is the sequence?
هسه هاي أكزيال.
Axial.
بس لك شوف لحظة. T2. T1 fat.
Yeah, Allah. Axial T1 fat set, which is the worst sequence to start with. So this is sagittal. T2 non-fat saturated. With contrast or without contrast?
T2 without contrast.
Yeah, Allah. Alhamdulillah. زين شوف قولوا لا Agree or not agree? Showing what? Speak. يلا دكتور طلع تعطينا الصورة هاي.
two vision, one hypointense,
Okay.
the other is heterogeneous in intensity.
Wait. Leave the mouse. Let's see. Let's see this one better. You would prefer this one. So what do we see? What's the sequence?
Axial, T2. لا T2 fat, not fat.
Yeah. No. زين. Showing.
Two region,
Mhm.
one heterogeneous in intensity, other one is hypointense.
Good.
Bilateral يعني I suspect from the ovary.
You suspect from the ovary. Good. Why not from the uterus? Could be a pedunculated fibroid, subserosal fibroids.
In the surgical uterus, normal.
Okay. بعد. What else? Is there pelvic free fluid?
Some free.
Some free fluid. Good. Any lymph nodes?
No, I don't see anything.
What about it? You have to speak that. There are no pelvic lymphadenopathy. What about the urinary bladder? The urinary bladder looks normal or abnormal. If abnormal, why? Normal. What about the uterus?
In this section, normal.
Fast.
Eh,
This section, normal uterus.
Normal
Bone.
bladder, normal bone.
Good. Good.
No, I need adenopathy.
Come on. Let's see the 131. Let's see on the corona first. This was the sequence. Fast.
T2, fat suppressor.
Detected.
ايه صح.
تمام. With or without contrast?
خلينا نشوف لحظة.
Let's شوفي. With or without
عادي
contrast?
تو باك كونتراست.
What do you see?
There's heterogeneous intensity. One of this is يعني not suppressed high. Hypointense. فقط hypointense.
So the left one was hypointense, staying hypointense. On T2, weighted images. The right one, heterogeneously hypointense on T2 and suppressed or not suppressed or fat saturated?
Suppressed this no, not suppressed.
Not suppressed on fat saturated images. So now what do you think? What's going on? Where they are arising from?
ما شفت الأوفري.
You didn't see the ovary. So what they are arising from?
From ovary.
From ovary, most likely. Okay, good. So now, what's your differential diagnosis? Or what you want to do?
Contrast.
You give contrast. What's this image?
Axial, post contrast, fat, suppressed.
T1 or T?
T1.
Good. Showing.
أخذت contrast. هذه
Always compare the pre and the post together to get a better idea of what is going. Sorry, what is the pre? This is the pre. So this is a pre and this is post.
not
So do we have post contrast?
no.
So did it enhance or did not enhance?
Not enhanced.
Yalla. So are they cystic or solid or complex cystic or solid with cystic degeneration? They are purely solid masses with no post contrast enhancement or يعني ممكن نقول minimal post contrast. I would say no, but حتى we play it safe. So
One of them is suppressed by fat.
not suppressed by fat. One is hypointense, one is hypointense. Both they are both not suppressed by fat cell. So the surgeon, the gynecologist, she's 60 something. So she did a hysterectomy with bilateral oophorectomy. What's your differential diagnosis?
Ovarian fibroma.
Ovarian fibroma bilateral?
bilateral ovarian mass يعني هم metastasis
Metastasis is a possibility, but we would think of enhancement more, free fluid more, pelvic lymph nodes more, possible signs of other extension to adjacent structures. What else? يلا Tony differentials.
Pediculated fibroid.
Pediculated fibroid is a very good differential. Could be bilateral pediculated fibroid. However, with a normal uterus, it's unlikely. Like what?
Desmoid.
Of course, it's soft tissue. Like desmoid. Desmoid vascular shows much better. Histopathology was bilateral ovarian fibromas, which is very weird to have a bilateral ovarian fibroma. When free fluid equals mixed syndrome, exactly. Okay? We did a chest abdomen pelvis later and it was normal. Yeah. So it was bilateral ovarian fibromas, which is quite surprising to have two ovarian fibromas of different signal intensities in this age group. I don't know. Anyway, thank you very much. See you next week.